Hey guys, Dr. Stephanie here. I'm a physical therapist, and today I want to talk about how to fix your shoulder pain. Obviously, shoulder pain can be caused by a lot of different things. Sometimes there's not a specific diagnosis, your shoulder just hurts, or it hurts when you do certain things. Or it could be caused by impingement or a rotator cuff injury, or you could have fallen on your arm. It could be an AC joint injury. So there's a lot of different injuries, and we're not going to go into specifics today. But if you have shoulder pain, the most important things to look at are what your strength looks like. So can you lift your arm up overhead? Can you lift it against pressure? Can you lift any weight with it? And also your range of motion. So can you lift it all the way above your head? Or can you only lift it to here? Can you lift it out to the side all the way up? Or can you only lift it to here? So strength and mobility are very important, and if you lack either of those, that can cause pain as well. So if you can't lift your arm all the way up overhead, obviously if you're trying to put a glass on a top shelf in a cabinet, that could be painful. So it's important to look at those things, and that's basically how we treat the shoulder pain is what are your deficits, what are your impairments, and then we treat those, and that can help fix your shoulder pain. And a lot of times we're sitting in a forward position. A lot of times we're kind of hunched forward. So that puts increased stress on the front of your shoulders, and it kind of lengthens and weakens the muscles in the back. So if we can get the muscles back here, including your rotator cuff, strong and get you into a better posture, that can help reduce some of that shoulder pain. So I'm going to go through some exercises today that you can do if you have shoulder pain. And you want to do all of these pretty pain-free. If you have a little bit of pain, that's totally okay, especially in the beginning. But if it's just so painful you can't do it, then definitely avoid that exercise and try a different one, and or maybe lessen the weight you're doing or lessen the resistance of the band. But these should be done pretty much pain-free. Maybe like a 1 to 3 out of 10 is okay, because when you first start doing exercises, you may have some soreness, you may feel it just because they're new and you haven't tried them before, and you're already having that shoulder pain. So if you have shoulder pain just sitting or just doing certain things, it's okay to have pain during the exercises because you have that pain all the time anyway. So you need to get those shoulders moving. You just don't want to increase that pain. So if you're sitting at a 3 out of 10 shoulder pain all the time, it's okay if during the exercise you have 3 out of 10 pain. But if it goes up to 6 out of 10, that's probably too much. And so you should kind of back off that exercise or just switch to a different exercise. Okay, so we're going to use just bands today for these exercises. One loop resistance band and then one longer resistance band like this. So we're going to start with this long one. And you're going to reach behind your back, hold on to it, kind of thumbs out position, palms facing you. What we're going to do is you're going to kind of pull out to the side and then reach back. As you reach back, you're going to kind of rotate your thumbs so they're going straight behind you. And you want to go back and then back down. So pull out to the side and back down. Out to the side, rotate back and back down. You want to maintain good posture, so you don't want to be slumping forward on this one. Keep your shoulders kind of back, pull apart, rotate your thumbs back and back down. You want to do 2 to 3 sets of 10 of this one, just like that. Okay, so now we're going to switch to the loop resistance band, and we're going to do a couple of shoulder exercises with this one. So for the first one, you're going to place the band around your wrists, place your arms up like this, kind of shoulders 90 degrees, elbows bent to 90 degrees, and we're going to do these reach outs. So I'm going to hold my right hand in this position. You're going to reach up with the left, then you'll reach out to the side, and then you'll reach down. So almost like kind of a clock movement. So up to the middle and down. Up, and you want to try, it's easy to let your elbows kind of fall as you do it. You want to try to keep them up here as you do it, like that. Because as you do it, if you're not paying attention, your elbow will slowly come down. So let me show you from the front. We'll do that. You'll do this on both sides. So hold it here. You pull up to the middle and down, and up into the middle and down. So you'll do it on both sides. You can do 2 to 3 sets of 10. I would probably start with two sets of 10, or you can even do 1 set of 10. That's a pretty tough one because you have to hold your arms up like that. But start with 1 to 2 sets of 10 and then increase to 3 as you're able. Okay, so then the next one we're going to do is an external rotation and lift. And so we're going to keep our palms out here. And so we're going to pull out to the side, arms out here, and lift up all the way, and then back down and together. So you're going to kind of rotate thumbs out, lift overhead, and back down. Pull apart, rotate thumbs out, up overhead as high as you can go, and back down. You want to make sure as you go up, you're not leaning back here. You want to keep your back straight. I'll show you that from the side. So rotate, pull out to the side, up overhead, and back down. 2 to 3 sets of 10 of that as well. All right, then we're going to go what I call these pulses. So you're going to just keep your wrists in the band, keep your palms facing each other, and you're going to just make pulses as you lift your arms up overhead, as high as you can go, and then keep pulsing as you come back down. This one's kind of a fun one. If you're at the point where you can't go all the way overhead like this, that's definitely okay. It's hard to do that, so just go up as high as you can comfortably. If it starts hurting like right here, just go down. And that's the other thing too. You may not have pain with the exercise, but you may have pain or discomfort if you get to a certain level. So the goal is all the way up here, but if you get to like 90 degrees here and you start feeling a little more discomfort, you can go back down and just go to that height until you're ready to go higher. So just pulsing up and down. You can do 2 to 3 sets of 10. Sometimes I like to do this in like intervals of 30 seconds. So you can do like 2 to 3 sets of 30 seconds. That works as well. Okay, then we're going to sit down. And these next two I'm going to show you, you can stand up if you want to, but sometimes sitting down in a long sitting position like this just helps to isolate the shoulders a little bit more, get some core activation. So I'm just going to show you them like this, but if you want to either sit in a chair or stand up, you can do that too. Okay, so we're going to hold on to this long band and hold it with your thumbs up, or palms up, but you're going to kind of put your thumbs up. So thumbs up, you're going to pull out across, come up, and then over your head, and then back down in front of you. Pull out, up, and back behind your head, and back down. All of these nice and slow, that's the other thing, because you really want to make sure those muscles are working. If you go too fast, you just kind of use momentum and don't necessarily get those muscles you're trying to strengthen. So here, and then back down. Again, 2 to 3 sets of 10. That's kind of my standard answer. You know, some things may be different. And if you're getting through 2 sets of 10 and you're really fatigued and it's really hard, stop at 2. That's kind of how you know if you should do 2 or 3. Or even if 1 set of 10 is really tough, just stop at 1. And then eventually, as you get stronger, you should be able to do 2 or 3 sets of 10. Okay, then in this position, let me face the front. And again, this one, we're going to do it in this long sitting position. But if you want to stand up or sit down in a chair, that works too. So you're going to pull across here and then back together, just doing a horizontal abduction. Nice and slow back together. It's easy to just let your hands kind of pull back together, but you want to go slow. Make sure you're working those muscles properly. Just across and then back together and across and back together. Okay, so if you're having any shoulder pain, try those exercises. You know, not every exercise is going to work for everybody, but those are some good ones to really work on building that rotator cuff strength, building this upper back strength, and reducing the stress on your shoulder joint. So try those and see how they feel.